So hi, this is Dr. Seda. Let's talk a little bit about the hormones and how to decide what is the best route of administration and some of the pros and cons of some of them, okay? So if you're a guy, the main thing that you want to know is that you want to get your testosterone at a level that you feel that is working for you, and sometimes that level is different from person to person. Typically on a regular lab you're going to have some levels that you're going to get, and they might give me, from 250 to 1100, and that would be a normal level of testosterone. Now why is that? Anything suspicious about that? It's a very wide range. So I'm gonna have guys that might be here at 400 and they have all the symptoms of low testosterone. Why that might be? Well, it's because they have low testosterone for themselves. It's just one of those things that for them is low. So how they even came up with this? Well, this is a bell curve. You have 95% of the people that were tested fall here. The lowest 2.5% falls here. The highest 2.5% falls here. So then pretty much you have a bell curve in which 95% of the population are here. So it's just normalizing sometimes disease. It has nothing to do with how people feel. You do another lab, the same testosterone level with another company the same day, and it's going to give you totally different parameters. This might be 800 and something, this might be 300 and something. So in reality it's very arbitrarily. It has to do with the type of testing that was done, the population. So in reality, not based on science more than anything. Now, how do we put testosterone in the body? In men there's different ways, but three main ways that we utilize. Okay, so the first one is going to be, actually four. The first one is going to be the let's talk about the creams, okay? Because a lot of people know about creams or gels or topicals, okay? Those creams or gels, for the most part, there's going to be some of the branded ones that you hear about in the news, and not in the news, but more like in ads and things like that. Now, they're not meant to take you to a higher level here, okay? They're meant to take you somewhere in the what's considered normal range. So when you have, I like sometimes to do things in a visual form. So let's say this is testosterone. Here you have a level of somebody that is symptomatic at 300, let's say, and from here you have 600 and you have 1100 here, okay? Let's do some lines here. Most guys above 600 feel that their testosterone is working pretty well. A lot of guys above 500, it just really depends. But let's say that we want to be in between here, between the 600 and 1100. Let's call this the happy zone, okay? This is where you want to be. Now, you put a cream in the morning, and what's going to happen? Actually, you're barely going to get there. A lot of times you're not going to even get there, okay? So they might get you at the normal range, but for a lot of guys it might not be enough to make a significant change. But actually for a lot of percentage of the guys, just being closer to here makes a big difference, okay? So that might be one of the therapies that can be done. It's just not going to take you to those higher therapeutic levels, okay? You put it once a day, and then you apply once a day. Some of the main things that you need to be aware is to avoid contact with other, with kids or wives or things like that, okay? Because it can be transferred. If it's in your hands or even in your arm, and you put the arm on the sofa, and somebody comes 2 days after, they still may get some because it stays active in the room, at room temperature, okay? Now, the next thing that we have is going to be the sublingual, okay? And the sublingual is something that you put twice a day, goes under your tongue, and what it does when it's put in the body is going to do this, okay? This is the red is the sublingual, kind of like spikes like that, and then does that, okay? Typically you need to take it twice a day, okay? And when you take it twice a day, there's going to be some fluctuation, but you're going to be on that zone for quite a bit of the day. A lot of times it overshoots and it absorbs quickly and dissolves quickly. One of the main concerns with that therapy is that sometimes it can be, some of it you can swallow, okay? That's just one of the main things. You don't want to swallow testosterone if you can avoid it. So with this therapy, you need to be making very sure that you're not swallowing, almost none at all. Everything, you know, sits in the mouth and it dissolves there. There's Troches rapid dissolving tablets, and you know, both of those are options. Okay. Now the next one that we have is the injection. Okay. The injection is something that sometimes is approved by insurance if the level is lab low, which typically is below 300, but it really depends on the person and different factors. Sublinguals typically are not covered. Creams sometimes, depends on the case. Okay, so in injections, you do it once every week. Okay, so for an injection, you put it in and it's going to do this, and that's going to be 1 week. Okay, now you're going to be in the zone for a while, but a lot of times you're going to overshooting for a while, and then you're going to be under for a while. So we try to match it and do it once a week so we get the least variability as possible. If you do it every 2 weeks, you're making bipolar men, because, you know, I feel good, I feel awful, I feel great, oh my god, what's going on? And it's just a roller coaster and nobody wants to be there. So that's why we try to make it as much as we can so that doesn't happen. Okay, so the last thing that we have is going to be the pellet. Okay, and the pellet is considered the most advanced form of hormone replacement therapy. And what it is something that you put once every 5 to 6 months in men. And you know, it's just one of those things. Well, with the downsides of injections that I didn't put here, you know, it's like you need to inject yourself. So for some people that gets old, you know, it hurts. But a lot of guys do, you know what, it works pretty well for me. They get used to it, and they're, you know, it's just part of their lives. Okay, so I mean, it's very doable. Now the pellet is something that for the most part you put it in, stays in your system. And how does that work here? Pretty much this would be the way that it would go. Okay, it would just go in like that, and then do this, and it would stay at a sustained level in that happy zone for most of the 4 or 5 months in which it's going to be active. Okay, so actually 5 to 6 months in some guys. I mean 4 to 5, 5 to 6. In women lasts a little bit less. In guys typically up to half a year. In some of them, you know, we can see. Okay, now what is one of the downsides of it? Well, we get a very good level, and then you have a good level of testosterone, and that's pretty much, you know, the thing. You're gonna have a good level. You don't have to do anything else. You don't have to take, you know, anything every day, but you're gonna be there, and it's something that eventually is gonna go off, and it'll take that amount of time, 4 or 5 months to actually 5 to 6 months in guys to be off your system. But you're never going to go back down here, which is where a lot of the symptoms happen. So what is going to happen is that you're going to be staying there for longer at a higher level, which is typically a good thing. Okay. Now, when we look at the pricing of this, the cream, one of the problems with the cream is that you know, if it's not covered by insurance, then, you know, obviously it's out of pocket. There's a wide range of prices on it. It depends on the pharmacy that you go to. Sometimes we can compound the cream and make it at your own dosing, which can be helpful and get you to a higher level, but it might be a little more costly. I mean, it just depends. But I mean, it just really depends on if it's covered or not, and it's just hard to say. But I would say if you go out of pocket, it might be anywhere from around 60 to 80 or so, depends on the pharmacy. Sublinguals run anywhere from like 45 to 60 or so. I mean, it really depends on the pharmacy, and this is in our area with our experience, but this, you know, is subject to change. Injections, I mean, it really depends. We've seen wide ranges. It really depends on what pharmacy. There's some that are cheaper than others. You might have to call around, but it's going to be around here. And then the pellet is like getting medicine in bulk. You're getting a medicine that lasts for pretty much 5 to 6 months, and you're buying it at once. In men, it's either $625 or $725. Okay, and it includes everything. It includes the procedure, which is important to know. So the pellet, the procedure is we do a tiny incision on the skin after putting some numbing medication, so it really doesn't hurt. Then you go ahead and we deposit the pellets that are a little larger than a rice grain, and we deposit, you know, how many we need, and then we put a band-aid, you know, and then you're good. It just closes. You don't need nothing to get out, no stitches, because it's just tiny. For 1 week you shouldn't be working out too much your glutes or, you know, soaking in water. Those are the main two things. Other than that, it's something that we can probably schedule if it's something that you want to do. Okay, the pricing, it depends on the dosing, and the dosing is depending on a calculation that we do based on your weight, your activity level, your hormone level, and your age, and all those taken in consideration with the experience, and we determine, you know, what's going to be the best dose for you. And then what we do is, in order to know that you're getting to the right place at 6 weeks, okay, we check, and if you're not here, we'll give you a booster for free, because it's the only way that we can guarantee that you're going to get to the right place. And that, you know, helps with compliance, so we don't have to worry about taking things. Now, all of them are options. All of them are options that we can do. It just really depends on the person and what's your preference. So, you know, just let us know if you have any questions on how to do that or some of the specifics. But all of them are pretty much bioidentical hormone, testosterone. The injection has a component that it might not be necessarily, but once it's in the system should be identifying it as bioidentical. Okay, so for the most part, they're very similar in terms of what they are. It's just the delivery method makes a huge difference. Okay, there's other little things that I can talk about it, but just to make it simple, and if you have any questions, just let us know. Thank you.